conscious, unconscious athlete evaluation, primary and secondary surveys. History. Try to find a history from those around. Mechanism, injury, previous medical history, current medication or allergies, observation, and the way the athlete while putting on gloves, environmental factors, weather, field, hazards, equipment, body position, patient on ground, arms above head may indicate spinal injury. Sphere building, gross deformity, skin color. An athlete, check for consciousness. If unconscious, send someone to activate EMS, no time. Primary assessment. Don't remove helmet. Check for obvious signs of life. Look, listen, feel for breath for 10 seconds. Get AED. One rescue, ratio of 30 compressions and 2 breaths, rate of 100, 120 compressions per minute. 2 rescues, ratio of 30 compressions and 2 breaths. Surgeon AED recognizes rhythm. Alert 911, CPR, rescue, breathing in progress. Life-threatening bleeding. Check for severe bleeding. Control direct pressure and pressure points. Breaker femoral arteries. Spinal injury precautions. Stabilize, mobilize neck head. If assistant present, have assistant stabilize neck and apply cervical collar. Log groans primary of the patient. If qualified assistant present, coordinate with EMS. List signs, symptoms of shock: pale skin color, cool clammy skin, weak and rapid pulse, shallow rapid respiration, pupils and dilated when shock, blood pressure may be falling, bright red heat show, pale blue hemorrhage. Taken vitals: level of consciousness, pulse, blood pressure, respirations rate and depth, skin temperature and appearance, pupils probe, pupils equal reactive to light. Secondary assessment: history. Where does it hurt? Do you have any pain in your neck? What happened? Did you hear or feel anything? Do you have any numbness or tingling sensations? Can you move your hands, wiggle fingers? Can you move your feet, wiggle toes? Orientation. Check level of consciousness. Ask who, when, where, what were you doing. Head to toe survey. Check for obvious severe injuries. Bleeding, fractures, deformities, edema. Look for normal to see abnormal. Head. Scalp, eyes, ears, nose, mouth. Blood, CSF. Cervical spine. Check if no cervical color. Point tenderness, dislocations, abnormal alignment. Thoracic and lumbar spine. Check if no cervical color. Point tenderness, dislocations, abnormal alignment. If trunk, clavicle, shoulders, chest. Movements on both sides equal, normal rise and fall. Rib compression test, crepitus and falso abnormal movements. Abdomen, check 4 quadrants, rigidity, tenderness, and rerun tenderness. RUQ, colon or liver, gallbladder, colon, right kidney. LUQ, stomach, spleen, referred pain to shoulders, curse sign. Pancreas, colon, right kidney. RLQ, colon, intestines, appendix, McBurney's point, ureter, females, ovaries, fallopian tubes. LOQ, colon, intestines, ureter, females, ovaries, fallopian tubes. RLLQ, bladder, females, uterus. Pelvis, compression test. Pelvis compression test. Fractures. Outward rotation of hip and appears longer as common sign. Dislocations. Leg appears shorter and inwardly rotated with knee flexion. Legs and feet. Check for fractures and bleeding. Check dorsal pedal or posterior tibial pulse bilaterally. Check motor response. Plantar or dorsiflex feet bilaterally. If unconscious, scratch foot, Bavinski response. Great toe extend and other splayed, upper motor neuron lesion. Check sensation. If unconscious, scratchy charge of foot. Arms and hands. Check for fractures and bleeding. Check radial pulse bilaterally. Check motor response. Squeeze fingers bilaterally. Check sensation. If unconscious, scratch each palm. Recheck vitals, level of consciousness, pulse, respirations, blood pressure, skin temperature and appearance, pupils pearl. This concludes the primary and secondary surveys, and now I have a better understanding of the specific injuries. I will maintain air rate and continue to perform rescue breathing and/or CPR until relieved by medical personnel. I would control bleeding, splint fractures, treat for shock, recheck vitals every 5 minutes, continue to maintain level of consciousness constantly. I would then refer my patient to a physician as needed.